Hello, dear friends. My name is Sofia Dorinskaya. I am a doctor, and today we will talk. I will answer your questions. We will discuss why tests are needed and why physical examination methods are important. And of course, I understand people who don't have a special education, who rely on tests, and who rely on methods, examinations, checkups. If a person does not have a medical education, specifically a doctor's medical education, it really may seem that technology will show everything. The magnetic resonance imaging knows everything. The X-ray knows everything. You get your blood tested, and your whole life is right there in front of you. So it opened up. What, where, why? And you can practically read it like the book of life, like a book of predictions, and say what was, what is, and what will be. But the truth is that all research methods are called auxiliary methods. For some reason, people don't talk about this. For some reason, they forget about it. And unfortunately, nowadays in medicine, the doctor with their knowledge and vision is being pushed aside. And I even know that a doctor, for example, can't make a certain diagnosis if they haven't found physical evidence to support it. Some test didn't confirm it, or some examination didn't confirm it. But now it's the accountants who are in charge of medicine, deciding whether to pay the doctor or not. And the way things really work, the way it all happens in nature, those are, of course, completely different things. Medicine will never be effective if you remove the educated person from it, not artificial intelligence, but an actual doctor. Because, as I said, all additional methods of examination, whether physical or instrumental, are just supplementary methods of examination. For example, if a person shows signs of insulinoma, a specific type of pancreatic tumor, they are sent for a scan, for an ultrasound, etc., but nothing is found. The subtitle editor, but the person shows clinical signs of insulinoma, editor. And actually, the doctor, editor, proofreader should make the diagnosis based on the clinical picture, because they can see why. Because the computed tomography scan slice may be larger than the tumor itself, ultrasound might also miss it. The machine might not be set up correctly, or the doctor might not see it. Or, for example, the same pituitary tumor. It's the same thing. The doctor sees various signs of a pituitary tumor and sends the patient for a computed tomography scan. It wasn't confirmed, and he can't officially make this diagnosis because the computed tomography scan's slice thickness was greater than the tumor itself, even though all the clinical signs indicate that the person has a pituitary tumor. And now, since doctors are taught that you must have confirmation, if you don't see it, if you don't know, you absolutely have to find where that crutch is. Something has to confirm that you are right. And even the doctors themselves are now getting confused sometimes, like, what exactly are they looking at? So, is there a tumor or not? Why isn't it there? Well, that's exactly why it's not there. And how can you tell if the lab gave incorrect test results? Yes, you also check. One clinic, you send the test to others. And we were taught that the first thing you should suspect is that the laboratory made a mistake. The reagents were old, or the lab technician calculated it incorrectly, or they messed up these tests, or something else, something else, something else. And the first thing, where to? If the doctor doubts the test results, she should send the person to retake these tests. Why? Because the clinical picture does not match what these tests show. So when I read questions like, tell me, What tests should be taken for vitamin and mineral deficiencies? Of course, this makes me smile because no tests ever indicate, and it's impossible to determine vitamin or mineral deficiencies from them. Why? Let me explain deficiency to you. Do you like beautiful bags or some beautiful clothes? Let's discuss Louis Vuitton bags. Let's step back from everything else and focus on them. For example, you like them a lot. And you walk down the street and pass by a store window where there's a Louis Vuitton bag that you like. And you just walked past that store. Please tell me, does the fact that you walked past the store where the item you liked is displayed mean that this item now belongs to you? What do you need to do for this item to become yours? You have to go into the store. You have to pay money, make some kind of exchange of goods. You have to give something money and take something. This item, the bag. And how will you understand that this item belongs to you? What word can you use to describe the fact that now you can take it home, put your things in it, and in the morning, take it and go out with this bag or put on this item? What one word can you use to describe that? How would you determine that this item is now yours? By its manifestations. How can others tell that this item is now yours by its manifestations? How can the store tell that this item is now yours? By its manifestations? In the warehouse, it's gone. It's arrived in the bank account, and so on, according to the manifestations. What's the point of knowing that some substances are circulating in your bloodstream? I mean, what's the point if they're not toxic substances, for example? Yeah, so they just passed by, like you walked past a store with a Louis Vuitton bag? Well, they looked at those cells and just moved on. Which ones? What would happen if if you managed to get into that Louis Vuitton store? You wouldn't be left out on the street. If someone was waiting for you outside and you went into the store, then definitely. According to the tests, you're not in this bloodstream. You're not in this current. Does that mean that when you have a situational blood test and there's a low level of a substance or a substance is missing, does that mean the body is suffering from a deficiency? Why are you already standing in this store and buying your bag? The substance has already entered this cell, and metabolic processes are taking place. But how can you tell if metabolic processes are happening in the cell or not? By the manifestations? That's exactly why right now we have a really terrible situation with this vitamin D. People are getting these tests done. People are starting to take this awful vitamin D in some astronomical doses. And then we see how people come to us. And suddenly, out of nowhere, they develop stone disease. Any kind, gallstones or kidney stones. Of course, because all of a sudden, a vitamin that is produced in the body, if you don't live in some kind of badger burrow, and I don't think you do, for years, only coming out into the sun once every 5 years. Vitamin D is produced in the body, and when you start carelessly overloading your body with vitamin D, you start to lose the vitamin that inactivates it. That's where you get things like kidney stones, poor health, and in general, you're just balancing on the edge like that. Or do we have it here too? One day, I got a strange letter. Someone said, I have a normal amount of nicotinic acid, according to my test results, but based on my symptoms, I have pellagra. That's right, because you're standing outside, and the Louis Vuitton store is still closed, and you were counted outside. But you should be inside the store for the symptoms to appear. Yes, for example, a deficiency, or for the symptoms of deficiency to go away, you need to go into the store. Right now, you're just standing outside, and the symptoms of deficiency are in the store, but you're not there right now. Do you understand? This analogy is clear to me. You must enter the cell, allow the substance inside, and enable the metabolic process. That's why relying on and eliminating nutrient deficiencies based on tests is impossible, has never been possible, and never will be possible. And only competent knowledge of the symptoms, the ability to work with them, and the ability to interpret them, to understand what's happening right now. Only this knowledge of a real person, a professional, only this knowledge can actually resolve the situation. That's exactly why no one has been able to eliminate nutrient deficiencies so far, because they're looking at the wrong thing. What's the point of looking at who's walking down the street? When we're interested in what's happening in the store, we're interested in what's happening in the cell, we're interested in purchasing power. Of the substances that walk past the stores, whether they go into those stores, and whether they carry out exchange processes there. You see, and the manifestations. We're interested in the manifestations in a particular organism. That's what it is. A test for nutrient deficiencies. You see, that's why it's impossible to rely only on lab tests. That's why if you look at the manifestations, but the tests tell you something else, the first thing you think is that the tests are wrong, that the tomograph step is off, that the reagents were old, or that in the end, the equipment is not properly calibrated. Right now, there's a big problem because, they're getting rid of doctors and lab technicians to save money, buying equipment, and I've read publications by doctors and lab technicians saying that these machines produce such results. Well, it's really difficult in medicine to give up the knowledgeable human perspective and think that medicine and helping people with their health will still remain at a high level. That's why this is the focus. That's what it's made of. Knowledge of symptoms, understanding what's happening in the cell, and proper interpretation. This is exactly what our nutrient deficiency test is focused on, and this is what our method is all about. And although people should always send in the doctor's reports from the specialists they visit, as well as the test results they have, but the most pointless tests you can do, and the most pointless way to spend your money, these are vitamin tests because they don't show anything at all. Moreover, if a blood test shows a normal vitamin level, but the symptoms indicate a deficiency. We've talked about this many times before. What does that tell us? That means this substance never entered the cell. It just floated around and then left. While in the bloodstream, where is it? Well, they stuck a needle in there and saw that it was just floating around. They never actually went into the store, never bought the purse. You see, I hope I answered your question about what tests are and how much you can trust them. Just blindly, without any knowledge. It's always a crutch. It's always an auxiliary method. but the decision is always made by a living, educated person who is called a doctor. It's always more important than any tests, no matter what they are. Thank you for your attention.